I am talking to Dion McNeal from the McLean County Health Department. Is that right, Dion?
That's correct.
All right, and I appreciate you taking time this afternoon to talk with me. And of course, I had called you earlier and was inquiring about our first case of Covid-19 here in LeRoy, and to get some more information. And you agreed to call me back here, and just to kind of set the tone, we are not going to be giving out any personal information or anything that would give away the identity of the individual we're concerned with here, right?
That's correct.
In other words, a location or anything like that. So we're on the same page there. And
I'm glad we are.
Yeah, we don't want to, mess with anybody's privacy here. But I would like to find out, if you could tell us the age of the person and the sex to begin with.
Yeah, so I've went back and I reviewed the information, and of course our protocol and our rule, and in regards to sharing an individual's, their age, their condition, and their sex. Given that this case is only one, I'm unable to share that piece of information only because those key pieces of information can actually be used to identify who the individual is.
Okay.
So our general practice here at the health department, if you're a smaller community or a small community, and we get a case in your community that's less than 5, we won't release that information due to the protection and the privacy of that individual, and that is the sole reason for that. But if it's above 5, in the community that you live in, then of course we would post that information. But anyone can always go to the McLean County's health department website, and we actually post every day our case numbers and of course the increase of that. And you can also access that information as well at IDPH website under their COVID-19 resource page as well for county case numbers.
Okay, I understand all that. Could you tell us now what the procedures were here? I mean, how did this individual know that they were infected? Can we ask you that?
Yeah, so I can't speak to this individual specifically, but if they, just speaking broadly, as an example here, if an individual is someone who is at home working, and they're working from home, and they are, they go into the grocery store and they realize that they're starting to have symptoms that they weren't having before, and they went and got tested, and they gotten their diagnosis, and it comes back positive. Here at the health department, our protocol is that we actually follow up with that individual in regards to how they're doing, their condition on a daily basis, and we also talk with them and ask just some really brief questions on where they've been, when their symptoms onset, the different folks that they had close contact with, and from there, we then reach out to those close contact individuals, or in case there is a possible spread in a public setting, we reach out to the business, and of course they have their protocol and their practice that they follow. But going back to the individual, we make sure that we get in contact with them and we follow up with them daily on their condition, when their symptoms have gone away, and then we also follow up with any individuals that may have had close contact with them, and then so on and so forth. This is a process that we call contact tracing,
right,
where an individual comes back and they tell us their results, or we get their results, and then we follow up with them and we make sure that we're cataloging or collecting that data so that it can be shared in our system, but then also to the state and the nation numbers, and just another way for us to keep track of those individuals and making sure that they're getting the care and the support that they need so that they do recover from COVID-19. Now, on the other hand, if it was an essential worker, so if this person was working at a grocery store or maybe at a auto mechanic shop, a gas station, some of those, more of those businesses that are actually essential to the livelihood of this county, then what will occur is we will follow the same practice. The only difference is in this scenario is that we would actually reach out to the facility and we would contact them to just kind of go over the scheduling, or not too specific of the scheduling, but like where that individual was at and if there was any potential exposure, and then we follow up with that facility to make sure that they have the proper guidance and they have the information from us to know when to recognize or reach out to us. But that's only if we see an essential employee and there is a potential risk. But whenever there is a facility involved, we do reach out to them and we work with them to review pretty much everything to make sure that the facility is clean from top to bottom, from bottom to up, and that we're aware of the people that's going in and out, and that they have the proper protocols in place in case there is individuals who are in there who were recently tested positive for COVID-19. So it's just making sure that they have those protocols in place and also following up with them as well and working with them.
Wow, and you you must have a lot of people that work on just like one case, right? Takes a lot of individuals to cover that.
Yeah, well, it's I know down in our communicable disease division, and that's where really they do a lot of the contact tracing.
Yeah.
They all compete from just the phone call itself from 30 minutes to an hour, but then the paperwork and the process that goes in behind that phone call, it is a lot. So yeah. I think our team is doing a really good job in handling the load. However, I know with things starting to reopen and folks wanting to, go out and maybe there's a risk of exposure, I know that we're probably going to have to increase our team as far as our contact tracers, which is what we've been discussing and what was part of our meeting today is making sure we have a plan in place in case, we see that uptick.
And that was going to be, one of my questions, but it sounds like you really have an extensive program going over there, and it sounds like you're doing a great job so far. We are fortunate, I guess, that it's a smaller community that we're talking about here than like New York City or someplace like that, where I can't imagine how many people it would take to really to do a tracing there, properly. Is there a certain amount that you're preparing for now? Is there something that you think you couldn't possibly handle right now?
Well, I think we've been pretty great so far. I won't, curse the work that we've been doing, so I'll knock on wood just so I don't jinx it.
Oh, yeah.
But team, they've been really good at handling it. I know a lot of us have worked odd hours and haven't even come on, onto the weekend to make sure that the work is being done and that the protection of the public's health is occurring. I know I think, looking at the things that are unfolding in regards to reopening, different facilities wanting to reopen, I think as a precaution and as part of our recovery strategy, we want to make sure that there is a plan in place in case we do have to bring more folks in and train more people as far as what this contact tracing is, and I think that's even we echo that even from a state level and from a national level. I know that IDPH is looking into if there are folks who are considered external outside of the public health realm, that those folks can go to IDPH and they can submit that application and it'll go from there. But it's still in its early phase for that, but that's something, like I said, that we've echoed here at the local level in regards to our recovery strategy, is always making sure that there is a plan in place so that we're prepared if we start to see that uptick, and make sure that everyone's receiving the support and care that they need during this unprecedented time.
Well, I sure want to thank you for all the great work and hard work you guys are doing, and our thoughts are with you.
I think we all here at the health department follow the data, and we look at what's working, and we see the data shows that face mask and frequent hand washing and cleaning frequently touched surfaces are really great pharmaceutical methods to reduce your chances of exposure from COVID-19. I think one of the greater messaging that we've put out recently was really trying to educate everyone on what the face mask and also face coverings, what they bring, what's the value of those, and one of the messages that we promote is that my mask protects you, and then your mask protects me, and we try to really echo a lot of what that messaging is to some folks, because sometimes that comes off and it's like, you're just telling me what to do, and we're like, well, we just want to make sure that you are taking all of the right steps when you step outside of your home, and you're in places where maybe there are some folks who may have a underlying medical condition that they can't wear a mask. We want everyone to take the right steps based on the data and the science that's out there. And we try to echo a lot of that information in the most candid and most protective way possible. We don't want to big brother anyone, but we definitely want to make sure that everyone has the tools and the resources, and most importantly, the information to step outside of their home and feel safe when they do step outside of their home. So that's one of my encouraging tips with the face coverings. If you are someone who doesn't have access to a face covering, I know here at the health department, if you go to our website, McLeanCountyHealth.gov, or you can just search Health Department, McLean County, we actually have a page with 3 videos dedicated on how to make a mask from just a bandana, a sock, a paper towel, and I know that IDPH and CDC has released videos as well, how people can just make a cloth covering and some other alternatives. So if you are one of those individuals, I encourage you to check out our website for that information. My last tip that I do want to share with everyone here is to follow the science and the data. Go to credible sources such as the CDC, IDPH, and the McLean County Health Department. And don't forget WHO, World Health Organization. All of these great organizations are releasing really great information on a daily basis. I know here at the health department we have our phone calls, we get our alerts from IDPH and just all of the different updates, and we try to make the information not so wordy, but really easy to read and understand and share, and we realize a lot of this is, we can't do it all ourselves here at the health department. We kind of all have to collaborate together, so some of the information that we put out is from other community health partners as well. When we're promoting different ways that folks can protect themselves. So I encourage everyone to always follow the science, and if you are in question about what the science is out there, feel free to give us a call, or feel free to reach out to those different organizations. I know IDPH has a hotline as well as an email address that folks can access if they have questions related to COVID-19, and there is also an email address for our media contacts and our peers that are media focused that they can access if they have questions about COVID-19 too. So I encourage everyone to take advantage of all of that information that is out there.
Thank you, Dion. I have one final question and I'll let you go. Had you noticed any trend towards the virus spreading downstate Illinois here in recent times?
That's a great question, Larry. I don't really read and study the data. I do in my role, but from the conversations that I've had with my leadership and then also with our communicable disease supervisor, I think one of the things we've noticed early on with this pandemic was you saw when Chicago had a lot of their cases, and we weren't necessarily seeing a lot down here, but over time we started to see that trickle throughout the state. I think that's some very key data for us to watch as we start to move towards recovery. But as of that, that's most of what I know. I'm not the data guy. Okay. I kind of read it and understand what I can and share that and make sure folks have have an answer to that. But if that doesn't answer your question, Larry, I would be more than happy to get back to you on that after speaking with our communicable disease supervisor.
Yeah. But there is,
if possible,
there is a trend for more infections, right, going on downstate Illinois that you can see without being a data person, but you've noticed, right?
Yeah, I think we all in the health community have seen more and more cases here in southern Illinois, but I think that speaks to the testing that is available. So
okay.
I think I echo and reiterate what IDPH says.
Yeah.
The more testing that's out there and the more testing that's done, the more cases we're going to find, which is a good thing. It means we're following up these cases and we're getting folks into the care that they need.
Well, once again, thanks, and keep up the good work, you guys. We appreciate it. Thank you very much.
Thank you so much for having me on here, Larry.